When I left private practice, it was a hard decision because I was afraid I was going to lose the continuity of care I had with the patients. It was one of the things that really attracted me to OB, and the thought of getting to know people for a long period of time over the course of their lifetime, from being teenagers to having children to going through different changes in life, and it was one of the things that really I looked forward to. And again, I think it was one of the harder things. But over time, as I experienced private practice and being pulled in many different directions, I knew that I couldn't do everything for every patient and be there for everybody. If I did, I was going to give up something that was important to myself and time with my own family. And I think at the end of the day, it was the balance that made me okay with that. I think continuity of care as a hospitalist is definitely different than when you're in private practice. You have a different clientele of patients that become your continuity patients sometimes. The clinic patients that tend not to go to the doctor become your patients, but they do need someone to take good care of them. Over time, though, as you're at a program for a while, you'll see that you do have patients that are repeat customers. I know just this morning I did a C-section and I walked in to meet the patient, not even looking at their name ahead of time. And I tend to wear a Red Sox cap in New Jersey, which always is good conversation for patients and the families. And he's like, "You helped with our last C-section when we had that emergency." And so that kind of continuity care does follow you throughout the course of your time at work. There are patients that will request you over time for inductions, again, on C-sections if they had a good experience with you. Often we cover the private doctors, and when even the patients that are unassigned that we take care of, they often don't know you when you first walk in the door. And a lot of times they'll deliver the baby very shortly after they hit labor and delivery. And you have a different time frame to develop that continuity of care. It happens very quickly. And if you have very good rapport, you can develop that, without a problem. And the patients will be very appreciative. It's interesting. We all have friends that have gone to those big private practices and they see every physician except for the one doctor that's on call when they actually go in labor. And that's how I've always kind of justified, our job in a way. Again, when I was in private practice before I had kids, I would go and try and deliver every patient because I didn't have anything pulling me to be at home. Now I have, 2 children that I love to spend my time with. And and that was a way to balance it out. Another way you can get continuity of care, I think, as a hospitalist is with the staff that's in your hospital. The nurses and the physicians that work in our system often tend to deliver where they work. And those patients, when you can partake in their deliveries, whether it be triaging them or assisting with their C-sections, is, again, the long-term, relationships that can form that are different than the ones you had in private practice. I think medicine has really changed. And the traditional model that we've all used for the longest time really doesn't it doesn't work well anymore, just in the medical system that we're currently in. And I think that changing your mindset and kind of looking at how you perceive things really makes a difference in how you tackle your job and the patients that you take care